all families and staff proactive and clear communication with translations. So at this time, I'm going to turn the presentation over to Dr. Presidio, who will share more details of our recommendations for the reopening of school for the 2021 school year.
All right, thank you very much, Dr. Ivy and Dr. Brabrand. And I am getting a little bit of feedback on the microphone here. So just as a reminder to all the folks that are on our call, if you could please mute your microphones, and that will help with any feedback that we might be getting. But again, thank you very much, Dr. Ivy and Dr. Brabrand, and good afternoon to all of the members of the board. It's a pleasure to be able to present our proposals for reopening schools with you today. Before we actually get into taking a look at the different reopening scenarios, though, we did want to discuss a little bit of work that we've been doing to really try to understand some of our challenges and successes that have occurred during distance learning this spring. And we think it's critical to make sure that we're focusing on these lessons, to make sure that we're really developing a very responsive reopening plan that's going to meet the needs of all of our students and staff. So to start out with, we are currently in the process of conducting staff and family surveys, and we really hope that we're going to have a high response rate on those. So we would really encourage our staff members and our family members to complete those surveys, because that information will be used to help inform our lessons and be able to provide more information to the board on the June 23rd work session. But even before the completion of those surveys, we have conducted a number of different focus groups, and we've received feedback that is helping us kind of frame these lessons learned and to frame our proposals that we're sharing with you today. And the first area that I'd like to focus on is around our instructional model. And I think the biggest thing here is that we've really learned the importance of consistent implementation division-wide of our instructional schedules. It's really important that all of our schools are operating consistently with the same expectations that we have division-wide. We also know that there's a need for more synchronous student learning in any future distance learning or virtual learning scenarios that we might find ourselves in. And we've heard loudly from our parents that that increased access to live teaching or synchronous teaching really helps support and reduce the family burden for providing direct instructional support to their students. We also have learned that we need to have increased social emotional learning opportunities built into any virtual learning environment that we find ourselves in. Even more importantly, we've learned a lot about equity issues. We know that technology and connectivity have to be provided to everyone in the division if we can make sure that all of our students are going to be able to participate equitably in distance learning. But even more importantly, we've seen really the disproportionate health and economic impact that COVID-19 has had on certain segments of our community. And that additional economic and health burden has really strained our students' abilities to participate equitably in distance learning. And we're going to talk about some mitigation strategies for that as part of our reopening plans. Additionally, communication has been very important. We've learned that we need to have more two-way communication, not just one-way pushed out information from the division, but more opportunities to engage with our stakeholders in discussion and dialogue. We've heard from our PTA associations that we need frequent and consistent messages across the school division, and that we know that all of our communications, they've got to reach all of our families. So that means that we need to have oral interpretation and written translation services available to families who require them. And we want to make sure that our return to school success stories are also shared in the media. That's really important because we have so many folks in the school system that are working so hard on behalf of students and families that those stories need to be told. Additionally, as part of our focus groups, particularly with the superintendent's teacher advisory committee, we've learned a lot about instructional practices, technology needs, and staff support. And on the instructional side, we know that teachers need dedicated time to plan and work with their collaborative teams. And this is particularly true when any type of virtual instruction is necessary. It takes more time to plan for virtual instruction, and that means teachers need adequate time to be able to plan for that instruction. We know that we need to provide more professional development on virtual teaching strategies. We need to ensure that we have integration of digital citizenship skills and concepts into our curriculum. And we need to make sure that we're consistently including specials at the elementary level and electives at the middle school level. And those courses are really important for a whole child approach to education. And then, of course, thinking about next year, we need to think about updating our grading policies to make sure that they're really incentivizing and supporting student learning during any type of distance or virtual learning environment. On the technology side, in addition to ensuring one-to-one devices and connectivity, we know that we need to have a learning platform and a video conferencing platform that's reliable and stable and can support the division's large user load needs. And we also know that we have to have secure ways for our students to access those synchronous learning opportunities. And we also need to protect and honor our students' individuality while still maintaining security. And on the staff support side, we're learning more and more about the staff challenges that staff members face with childcare access and the need for continued professional development on a wide range of issues, even outside of instruction, but also on health, safety, and self-care. And then finally, we need to make sure that all of our teachers have consistent access to the internet and high-speed internet. Additionally, we've been examining lessons, obviously, at the local level, but we've also been monitoring what's been happening at the international level as schools around the world have reopened. And, you know, unfortunately, there's not really any international consensus yet on best practices, but there are some similarities that we can see in the way that many schools around the world are approaching reopening. So here we've provided just a brief summary of several different countries based on a research study that was done by one of our research partners that looks at some of those practices from around the world. And with respect to things that are similar, you can see all of the schools listed on this chart are reducing their in-school capacity. That means reducing the percentage and the number of students that they serve in school at any one time. They're also all enhancing their cleaning protocols and their social distancing protocols. But again, we do see countries taking different approaches to different practices like health screening, health monitoring, the use of PPE, and different instructional models. But still, nevertheless, we believe it's important to keep an eye on what's happening around the world, and we're going to continue to monitor these developments and use this information to inform our reopening plans as we get ready for returning in the fall. So next, what we'd like to do is provide a little bit of information on Governor Northam's guidance that was released just last week for reopening Virginia's schools. And it was on June 9th that Governor Northam announced a phased approach to reopening Virginia schools. And really the school reopening phases are similar to what's happening in the broader community and business reopening in the Forward Virginia blueprint. So in addition to the phases, school divisions learned that we are going to be required to deliver new instruction for the next academic year. And we're going to be required to have community mitigation strategies like physical distancing, enhanced cleaning in all of the phases of reopening. And then school divisions do have flexibility to be more limited than the state phasing with respect to in-person instructional offerings. And that needs to really be based in terms of decision-making on partnership with local public health officials and using local public health data. So this chart basically attempts to summarize the key elements of Governor Northam's 136-page reopening plan, and it really emphasizes the three different phases of this plan. So first, for example, you can see that permissible in-person instruction is allowed even in phase one, which technically, and I'll speak to this more in a minute, technically we're in phase one in education right now. So in phase one, you are permitted to have in-person instruction in really, really limited situations, just in special education programs with limits of 10 students in a particular room. You're also able to have childcare provided in the schools for working families. In phase two, then you see that in addition to serving special education students, we can serve preschool students through third grade and English language learners, and we could have summer camps in school buildings. And then by the time we get to phase three, you see that we have the ability to serve all students in person as long as they can be accommodated with social distancing measures. And that, of course, might require alternative schedules that would reduce the number and percentages of students attending in school in person at any one time and might require a blended approach of in-school and distance learning. Also, you see the limitations on gatherings. In phase one, there's a limitation of 10 students or individuals. By the time we get to phase two, there's a 50-person limit. And by the time we get to phase three, there will be updated executive orders and more information coming on what the actual numbers would be with respect to how many individuals would be allowed into a particular school building at a particular time. I think the next item is particularly important to note. You see in phase one for social and physical distancing, the language from the governor's plan prescribes 6 feet of distancing maintained between desks, tables, workstations, and between students and staff to the greatest extent possible. But you see that when we get to phase two and phase three, the language becomes less restrictive, and you're encouraged to have 6 feet of distancing to be maintained to the greatest extent possible. With respect to groups, we need to restrict mixing of groups in phase one and phase two, and we need to consider doing that in phase three and adjusting schedules as necessary. And then for activities and athletics, they're prohibited in phase one. We get some flexibility by the time we get to phase two for limited participation, and then phase three is still to be determined. And the same thing with respect to communal spaces. They're closed in phase one. They're closed in phase two unless we're able to stagger space use, and phase three is yet to be determined. There's some additional information we wanted to share about the governor's plan, and the first point is really important. The state plan bases their guidelines on following the CDC guidelines. And everything that you're going to see in our plan is directly based on the CDC guidelines and decision rules. Additionally, the state plan requires school divisions to conduct daily health screening of both students and staff for symptoms and history of exposure. It allows that to be done with self-reporting forms, and that requirement is in effect for phase one, two, and three. Also, face coverings need to be worn by staff when 6 feet of social distancing can't be maintained, and face coverings are encouraged to be used for students as developmentally appropriate and in settings where social distancing can't be maintained. And again, those guidelines apply to phase one, phase two, and phase three as well. And then finally, prior to entering phase two and phase three, school divisions are going to be required to submit reopening plans to the state. We just received that state template on Friday, so we have not submitted a plan yet, but we will do so shortly. And once that plan is approved, then we could move formally into phase two. But that plan has to include strategies for mitigating COVID-19 risk, and also our plans for instructing new content and addressing the learning loss that may have occurred during our school closure period. Also, we learned that we can seek waivers from the 180-day or 990 instructional hour requirement and the 140 clock hour requirement, but we cannot seek waivers for SOQs and SOAs that are going to require us to continue to teach the same state required content and provide the same state required services. We're also going to be required to take attendance and to grade work. So with that, the state plan, again, really does place a heavy emphasis on local authority and looking at local public health data with respect to reopening decisions. So we're very excited, again, and happy to have our colleagues from the County Health Department here with us today. I'm very happy to introduce Dr. Gloria and Dr. Schwartz, who are going to help us with a little bit more information about some of the COVID-19 trends and some of the mitigation and suppression strategies that are currently being used in Fairfax County. So I will turn it over to Dr. Gloria and to Dr. Schwartz.
Thank you. Good afternoon, Madam Chairman and members of the school board. Thank you for the opportunity to provide you with an update of the COVID pandemic response in Fairfax. We hope that the information that we provide will be helpful to you as you deliberate on how best to reopen schools as safely as possible. It has been 146 days since we activated our health department's incident management team in response to the outbreak of the respiratory illness now referred to as COVID-19. public health efforts to control the spread of disease has evolved over time as the outbreak has continued to spread. At the beginning of the pandemic, the focus was on preventing the entry of the virus into the United States, and containment measures focused primarily on travelers and their close contacts. As the pandemic has evolved, control efforts have had to be refined, and certain interventions that were critical in the early stages, such as the airport screening and quarantine of travelers, have become less impactful as transmission has become more widespread in our community. Several months ago, with the restrictions on gatherings and the stay-at-home orders, we moved into a community mitigation phase that seems to have been successful in curbing the explosive spread of the virus and the rate of new cases that would have overwhelmed our healthcare system. As we reopen and move towards our new normal, it is important that we stay the course and maintain these same social distancing and infection prevention measures, such as the wearing of face coverings, hand washing, covering coughs and sneezes, and staying home when sick. And that is because the sheltering in place measures have not altered the underlying conditions that can allow the virus to spread explosively as we resume our normal activities. The virus is still in our community, and the majority of our Fairfax population remains susceptible. So for the next phase, the health department is scaling up our contact investigation efforts while the healthcare system prepares for the potential surge in patients. And this practice of isolating infected people and quarantining those who may have been exposed but are not yet sick, what we call contact investigation. This is a critical part of the public health response to infectious disease outbreak, and has been the backbone of our COVID response right from the beginning of the pandemic. However, because it is resource intensive, it has its limitations. And so for us to reopen successfully, next slide please, we need to respond to cases quickly in order to suppress the virus. Our goal is to box it in using the 4 targeted interventions shown here, starting with testing strategically and widely. And fortunately, there is increasing availability of testing, and we continue to work with our community partners and engage in targeted testing in high-risk areas to identify symptomatic and asymptomatic cases. So the next step after in testing is to identify infected people quickly so that we can isolate them and so that the virus stops with them. And the third step in this strategy is meticulous contact tracing to identify close contacts of those who are infected, and then warning those contacts of their exposure and quarantining them for 14 days. The idea to create the idea when this strategy is to create a closed loop so that with each wave of infections, there are fewer secondary infections, and as a result, the virus is eventually boxed in. In determining how we scale up our contact tracing operations, we have looked at a number of models which recommend a contact tracing army of anywhere from 15 to 30 people per 100,000 population. And so our goal is to hire up to 400 additional staff by the time school reopens to ensure that school health program staff who have been deployed as part of this response are replaced. And our goal for the 400 individuals to do contact interviewing as well as case interviewing, and also to have community health workers, up to 70 community health workers who will help our case and contact tracing teams better connect with our diverse communities and ensure that our community members have what they need to safely self-isolate and quarantine. The box-it-in strategy is intended to prevent cases from becoming clusters and clusters from becoming an epidemic. How well it works will not only depend on these health department actions that I have just described, but on what we do together as a community, which Dr. Schwartz will now elaborate on.
Thank you so much, Dr. Gloria. And now the next slide, please. So there are a number of different factors which may affect the effectiveness of the box-it-in strategy. So the question I think we all ask is, will this strategy be effective? And will we be able to control the pandemic? And the answer depends on several factors. And I think it's really important that we understand these various factors. First, it depends on the extent to which infection prevention measures are maintained by our population despite the loosened restrictions. And we've all seen pictures of what's going on in some of the other states that had reopened before we had. And it really leads to some questions about whether people will continue to maintain these protective behaviors. Second, the strategy depends on identifying cases by testing. And despite the much greater availability of tests, we have some critical challenges. And they include the number of people who are totally asymptomatic and therefore never will get tested, people who may be mildly symptomatic and may not think about being tested or make the effort to get a test, and then people who may be concerned about the consequences of being tested, such as having to stay home and not being able to go to work. And because of all of those factors, there's really some uncertainty about how effectively the testing can be applied across the entire population. Third issue is the speed and the effectiveness of our public health investigations and contact tracing. And so, as Dr. Gloria has pointed out, the health department is hiring about 400 people to do this. And based on our experience reaching cases during the mitigation phase, which is well over 90%, I think we have some confidence about our abilities to meet this need. By contrast, there are some concerns about the extent to which people who are recommended for isolation and quarantine will be able to effectively maintain their separation from others. Some challenges include people who need to continue going to work to provide for their families, those who live in crowded situations and therefore find it difficult to separate themselves from others at home, and for people who are quarantined, getting them to maintain these behaviors even though they are not sick. So a final key factor is the biology of the coronavirus. We don't know, for example, what proportion of cases are asymptomatic and what % of disease transmission occurs from asymptomatic people, which makes it a little bit hard to project the effectiveness of this box-it-in approach. On the right part of this slide are the results from the University of Virginia coronavirus model that show the potential impact of changes in behavior as well as the completeness of case detection. And as you can see from those 4 lines on the right-hand part of that figure, there may be very different trajectories of the outbreak in Fairfax County, depending on what assumptions are made. Also, even though the x-axis on this figure is time, and there are dates that are shown, which make it look like a subsequent wave would be decreasing toward the end of August when school might be moving toward reopening. Given all of the uncertainties, I would not put much confidence in these particular dates. Next slide, please. So I'd like to move from describing the control strategy to share an update of the epidemiology of the pandemic. Shown here are some numbers from the Fairfax County dashboard, which is on the county's webpage. Because I needed to share these slides a few days ago before this presentation, the numbers that are shown on the slide are a little bit out of date. So let me give you the newest numbers. Today, there are 13,215 cases of coronavirus that have been diagnosed in our county, with 75 new cases added today. There also have been fewer than 100 confirmed cases for each of the past 7 days. And this compares to between 200 to over 300 cases per day at the peak of the outbreak in Fairfax. So really a quite substantial decline, even in the context of increased testing being done. The total number of COVID-19 deaths that have been reported to us is 436, but as studies from New York City and elsewhere suggest, the true toll is greater, as deaths may not be classified as being caused by COVID-19, but would be in excess of what we had seen in previous years. So Fairfax County has more cases than any other Virginia jurisdiction and accounts for almost a quarter of the cases in the state. But this underestimates the true burden of the pandemic because many people with disease are not tested because they are asymptomatic, have mild symptoms, or just don't get tested. In the University of Virginia mathematical modeling, they estimate that only 15% of cases are confirmed. Thus, the true number in Fairfax may exceed 88,000, which is almost 8% of our population. Next slide. So the trajectory of the outbreak, defined by the number of new cases per day, is shown here. The most recent 2 weeks is shaded gray on the right side of the figure because the data are not complete for this period, which suggests that the decline in cases is greater than it truly is. But what you can see is that we have experienced a substantial decline since the peak of infections occurred in early May. Next figure. The dashboard also includes a page showing the racial and ethnic distribution of cases, which identifies a disproportionate burden of COVID-19 among the county's Hispanic population. The pie chart on the left shows the racial and ethnic distribution of the county's population, and the chart on the right shows the proportion of COVID-19 cases in each group. While Hispanics make up 16.8% of our population, shown here they account for 65.3% of cases, and that's the updated number as of today. Another way to communicate this disproportionality is that disease among Hispanics is over 11 times that among non-Hispanic whites. By contrast, among African Americans, the rate is only 2.3 times that in whites, and the disease in Hispanics almost 5 times higher than in African Americans. One caveat with these data is that race and ethnicity are missing in about 20% of reports. The increased risk among our Hispanic population is not related to differences in biology, but rather to the social determinants of health, including the need to continue going to work, having jobs where telework is not possible and social distancing is difficult, taking shared rides or public transportation to work, lack of sick leave, for many, the unavailability of unemployment insurance, as well as crowded households, leading to greater difficulty to effectively isolate at home. Next slide. The differences by race and ethnicity also are apparent from these epicurves shown by race and ethnicity. You can see the much greater success in flattening the curve for African American, Asian, and white populations, while COVID-19 cases among Hispanics tend to be higher, and the increase continued for a longer period than for the other groups. As we think about the communities at increased risk, so far I've described this in terms of ethnicity with increased disease in the Hispanic population, but it's important that risk groups also can be defined more specifically by their geographic area, such as perhaps a cluster of cases in an apartment complex, or by individual socioeconomic factors. So again, I would emphasize that the risk is not being Hispanic, but it's the exposures and the activities that occur among people in specific communities. Next slide. COVID-19 in children is more characterized by what we don't know than what we do know. In preparing this presentation, I looked for data in the medical literature, both published and unpublished, on COVID-19 in children, and there is virtually nothing available. The fact that we don't know the rate of infection in children is likely related to children being more likely to be asymptomatically infected, so they are not tested. But even when seroprevalence studies are done, in other words, looking for antibodies that are an indication of previous coronavirus infection, those studies have not specifically commented on the rate of positive antibodies among children. Last week, we worked with HealthWorks to do testing for the community at a site in Herndon, and we found no significant difference in test positive rate between children and adults. And the numbers are very small, so this is anecdotal and really can't be extrapolated to our entire county. But for persons who are less than or equal to 18 years old, there were 6 of 39, or 15%, who were positive. And none of these 6 children who were positive reported having any symptoms. There also are some international data that were reviewed and summarized, which suggests that in household clusters that are investigated, rarely was the index case a child, and some data when a child when a child is a contact of a case, some data suggests that they are less likely to be infected than an adult contact. And these data are very different from what we see with influenza, where children are frequently the ones to introduce infection into a household. We also have seen the emergence of a new syndrome in children following coronavirus infection that has been termed the multi-system inflammatory syndrome of children, or MIS-C. This syndrome occurs in children who present with fever, prolonged fever, laboratory evidence of inflammation, and severe illness requiring with the involvement of more than 2 organ systems, including cardiac, renal, respiratory, hematologic, GI, dermatologic, or neurological systems. This appears to be a post-infectious complication that is related to the immune response, and we have had several cases of this syndrome that have been identified in Fairfax County. While it does not appear to be common, we are still learning more. Finally, I point out that the pandemic has impacts on children broadly that go beyond just those who are infected. There may be consequences associated with an increase in domestic violence or other responses to stress in the household, and you all are certainly more aware of the educational consequences than I would be. Next slide. So I'd like to conclude with a brief summary of the health department roles and engagement with the school system. And we've appreciated the regular conference calls that we've had with FCPS and the planning that has been done collaboratively with your team. As I've done today, we share the epidemiology of COVID-19 in Fairfax County with FCPS, and also we share these data with VDH, where they inform decisions that are made at the state level. We work with FCPS to conduct case investigations and contact tracing. And in the future, our case interviewers will ask every person who tests positive whether they're linked with a school, which will allow us to track cases, to identify whether multiple cases have occurred in a classroom or school, and then recommendations for isolation and quarantine will be made consistent with the Virginia Department of Health guidance. If an outbreak is identified, it will be investigated and appropriate guidance will be provided to the school. We've already discussed some scenarios with FCPS and will continue to work with colleagues from the schools and from VDH to define thresholds and actions. And these actions may include classroom-wide quarantine or school closure, depending on the number and location of cases. But again, that is work still to be done. and both defining the situations as well as the response to those situations. We have certainly appreciated the collaborations with FCS, FCPS, and look forward to continuing those discussions over the summer and throughout the year. Thank you.
All right, thank you so much, Dr. Schwartz and Dr. Gloria. We really appreciate all of this information. It's a great background for the rest of the conversation that we're going to have. And I know that board members will have questions for you as well. So we appreciate you being here with us. And again, we really appreciate all of your ongoing partnership and collaboration over these last several months as we've been working on our reopening plans. So as we transition now with the local health data as kind of background, what we'd like to share are the plans that we've developed based on the CDC guidelines for ensuring safe and healthy learning and working environments. So on this slide, what you see is the CDC guidelines that really is developed kind of as a decision-making tree. And it's put together in this format to help school divisions with developing their reopening plans. And in FCPS, we use this decision-making tool to develop our local criteria and our local guidelines for reopening schools that we'd like to share with you this afternoon. And here you really see the first questions that the CDC recommends that you need to address before moving forward with reopening. And the first question is, as we've just discussed with Dr. Schwartz and Dr. Gloria, are your reopening plans consistent with your applicable state and local guidance? So again, it's just really important that we emphasize to everybody that all final decisions about when and how we reopen our schools, as well as decisions about future closures, are going to be informed by the most recent local health data in partnership with the Fairfax County Department of Health. The second question that the CDC raises is ensuring that you're ready to protect children and employees who might be at high risk. So our reopening plans are built on the idea that we would be providing full-time online learning as an option to any students who are at high risk of severe illness based on the CDC criteria. And there's links in here to the CDC criteria for high risk, but it includes a lot of different categories like issues with lung disease, asthma, immunosuppression issues. So there's a lot of criteria in here that the CDC uses to define what being at high risk of severe illness from COVID exposure would look like. So for our students, we want to make sure that those students who are at high risk would have a full-time online learning option. And for our staff, we want to make sure that we have flexible leave and telework policies established and in place. Thirdly, the CDC recommends that we screen students and employees upon arrival. So we're working to develop a daily health screening form that would require parents to report that their children are asymptomatic and have not been exposed to anyone with COVID-19 symptoms prior to sending them to school each day. And we would have school-based staff, including school health aides, as available to help with screening of students who report those symptoms upon arrival, but do not have a health health form completed. And we would require staff as well to self-report being asymptomatic and without exposure prior to entering the buildings each day. So that's the first phase of the decision-making tree. The second phase that we need to address is making sure that the CDC recommended health and safety actions are in place. And the first is ensuring that we have healthy hygiene practices. So we've developed guidance, proposed guidance in FCPS around hand washing, when hands need to be washed, how frequently they need to be washed, for example, upon entering classrooms, making sure that we're developing schedules where we can provide breaks for students to wash their hands, and also ensuring in situations where we might not have soap and water readily available, that we have hand sanitizer that would be provided for students and staff members as well. Additionally, the CDC recommends cloth face coverings be worn by staff and students where developmentally appropriate when those social distancing guidelines can't be maintained. And we would seek to provide masks to students who were unable to provide their own. Additionally, there's guidelines around intensified cleaning and disinfection. So we're proposing daily sanitizing of high-touch areas like doorknobs and handles and fixtures with medical-grade sanitizing solution, more frequent monitoring and cleaning of restrooms, and then we have the ability to contract for cleaning services for deep cleaning and disinfection whenever it might be necessary. Additionally, we need to make sure that we have social distancing or physical distancing protocols in place. So that basically just means increased spacing of small groups and limiting mixing among groups. So we've developed guidelines to ensure that we could create separation on school buses, limiting visitors into our buildings, developing designated entrances by grade level, designating one-way traffic patterns through school, ensuring that students and staff groupings are as static as possible, certainly posting signs to remind individuals of the social distancing guidelines, and then trying to ensure that our desks are 6 feet apart and face the same direction, and whenever possible, having students eat meals in the classroom. And then the third component of the CDC decision-making tree is the need to ensure that we have effective monitoring systems in place. So again, just as Dr. Gloria and Dr. Schwartz said, we would be collaborating with the county to really monitor that county health department data, those cases, exposures, hospitalization rates, and other relevant metrics that might require a change to operating status. And if we did have an outbreak in a school or an office, we would collaborate with the county health department authorities, implementing all of those necessary health and safety protocols that were described that might require a change to our school operating status. So we believe that we've addressed the initial thinking behind the different phases of the CDC decision-making tree, and we've done that to establish those local guidelines here. So that really then brings us to what our proposals for reopening schools would look like. And I'd like to start by sharing the proposals that we've developed for 3 different operating scenarios for next school year that you see here. And I would note up front that these aren't really different options that would require us to choose between one or another of these scenarios for next school year. Rather, these are really different operating scenarios that we believe that we must be prepared to implement at different times throughout next school year. So the first scenario is virtual learning for all of our students. And we need to be prepared for this scenario in the event that we would have a resurgence of the coronavirus that might require us to close either a school or schools. In this scenario, students, of course, would not be allowed in our school buildings, and all instruction would be delivered through enhanced distance learning. And we'll explain that in more detail in terms of what that would look like. The second scenario is in-school learning with health and social distancing. And really our goal is to have as many students receiving in-school instruction as allowable under state guidelines and as approved by our county health department. So the state guidelines, however, may necessitate that we have a reduced in-school capacity in phase 2 and phase 3, of course. So it might mean that, for example, only 50% of our students, or maybe even only 25% of our students, might be able to attend school on any one particular day. This is also going to require those new health and safety protocols that we just discussed, and it may involve new instructional bell schedules to allow us to serve students on alternating days, and it might even involve prioritizing instruction for high needs populations like special education students, English learners, or our primary pre-K through grade 2 students. And then finally, is scenario 3, which would be online learning for individual medical need. And again, this would be full-time enrollment that would be offered to students as an option that are at high risk of severe illness from COVID-19 exposure as based on those CDC criteria. It could occur in either one of these scenarios or even under a routine operating status. And it would require additional instructional delivery for those students in different online models. And it may involve ongoing monitoring and intervention supports for those students. So that's a very high level overview of the 3 different scenarios. And what we would like to do next, before we look at the individual scenarios, is to just provide some information on some of the elements that would be present in any of these scenarios. So to start out with, technology and connectivity is going to be critical. For any of these operating scenarios, we want to ensure that we have one-to-one technology, meaning every one of our students has a personal electronic learning device and also has high-speed connectivity to be able to participate fully in online or distance learning. So we have ordered, of course, new computers for our middle school students. We already have devices for our high school students, and we recently ordered an additional 22,000 laptops to ensure that we can deploy devices to elementary students who need them. We're also working really hard to ensure that we have either home internet access with additional MiFis as provided by FCPS, or we're also working with internet service providers to try to develop additional free and low-cost internet partnerships. In all of the scenarios also, we're working on enhanced assessment practices to ensure that we have the ability to identify individual student learning needs at the beginning of the school year. And we're streamlining our curriculum to make sure that we're focused on the most important content standards from both the fourth quarter of this school year and next school year. And we're developing units and lessons and assessments that will support student learning and support teacher planning so that teachers can spend less time planning and more time focused on individual support for students that need it. Additionally, we're working, it's in the budget that we'll look at in a little bit, we're working to purchase new materials that will provide digital self-paced or self-directed learning opportunities to our students in math in grades kindergarten through grade 8, and in literacy in kindergarten through grade 6. And we believe that these materials will provide us with a lot more opportunity for self-directed learning and will ease that parental role and responsibility that many of our parents had to assume during distance learning this quarter. And we're also working to develop new resources and supports for social emotional learning with new screening tools and new curriculum and lessons as well. And then more importantly is really the work that we have to do to put an equity lens on our reopening plans. And as I mentioned really at the outset of the presentation, we know that COVID-19 and school closures have really had a disproportionate impact on some of our most vulnerable communities. So really now our challenge is to ensure that we're doing everything possible to mitigate those inequities. And that really starts first with our special education students. We know that they need increased time for synchronous instruction. Those expectations need to be consistent across all of our schools. We need more professional development for staff, and we need more training for our parents. And we have to ensure that students really are included in the least restrictive learning environments as required by their IEPs. We need to continue to provide instructional materials for our students to use at home that range basically from school supplies all the way to the necessary assistive technology that they need to participate fully in distance learning. And then whenever necessary, we need to make sure that we're able to convene virtual meetings for special education purposes so that there's not delays in services that students are entitled to. And then secondly, for our English language learners, many of whom are Hispanic, and reflecting on the health data that Dr. Schwartz just shared about the disproportionate impact on our Hispanic community, we need to make sure that academically we're doing everything possible to support our students. So we need to ensure high quality, designated minimum amount of time for English language development for our students. We need to make sure that we're developing additional assessments to identify student learning needs and targeting instruction to those needs. And more importantly, we need to really increase the amount of family outreach and support and education with our families so that our families understand all of the resources that we have, not just in FCPS, but in the county to support them and supporting their students. And wherever possible, we want to ensure that we have bilingual counseling, social work, and psychology services available to our English learner families. And then finally are the intervention services. We continue to hear a lot about the amount of learning loss that we might expect with our students when they come back to us in the fall. We've been working very hard to minimize that this spring by working to identify students who might be at risk even before distance learning began, contacting those students whenever possible through their base school and providing whatever supports that we had the ability to provide. And we're wrapping up the school year by identifying students that we believe need additional supports in the summer and in the fall to be successful. So we'll be able to start on the first day of the new school year with providing those intervention supports and resources to students as soon as the new school year starts. So we've done a lot of that work with really looking at systematic data collection. We're going to continue to monitor students' progress, and we're investing, as you'll see in the budget, a significant amount of funds to support those intervention services at individual base schools. So all of our base schools would get additional funds to hire additional hourly staff to provide in-school and out-of-school additional academic supports. And all of this work is going to be framed around our multi-tiered systems of support. So we're going to continue to enhance our professional development and coaching for all of our schools in multi-tiered systems of support. So with that background in mind, I want to go through the 3 different scenarios in a little bit more detail. The first scenario that we're looking at here would be virtual learning for all students. And of course, in this scenario, students would be learning at home. They would not be in the building. Staff would have access to the building for instructional purposes, but students would be at home. The instructional schedule that we're proposing would have 4 days of synchronous learning per week and 1 day of asynchronous learning for students to provide that necessary teacher planning time. And you can see what that would look like in terms of the different grade levels and the amount of synchronous instruction and asynchronous instruction on the slide here. I won't read through all of that for you, but I do want to highlight just a couple things. If you compare the amount of synchronous instructional time in this proposed model to what we're currently doing during distance learning this school year, it's essentially double the amount of synchronous learning time and support from what students are receiving currently. So another way that you could look at that would be to look at a sample schedule that we've represented here. So again, you could see those 4 days a week. Students would be within that virtual synchronous learning model, Monday through Thursday, and again, a sample schedule from the different grade levels here at elementary. And then on Fridays, that time for asynchronous work, that could be independent or it could be collaborative work virtually that students would work on. And again, giving teachers that really necessary dedicated planning time because it does take a lot longer to plan for virtual instruction. At the secondary level, our middle school and our high schools, again, you would see that students would have 4 days of synchronous instruction compared to the 2 days that they have this current spring. And one thing that I would point out here is that you'll notice in the elementary, middle, and high models that we are trying to have the teacher collaboration day, asynchronous day on Fridays. And the reason for that is we believe that if we had to use this model, that it would be helpful to families that might have students attending elementary and middle or high to be able to be home together on the same days, and that would support families with childcare issues. So that's a look at scenario 1. And scenario 2 then would be in-school learning, of course, with those health and social distancing guidelines in place. So here you just see a reminder of some of those health and safety guidelines we discussed, those health monitoring protocols, the use of a daily health screening form, social distancing guidelines of 6 foot of separation wherever possible, limited mixing among groups. That would include social distancing on our buses. And again, that ongoing collaboration with the county health department to really make sure that we're responding to any outbreaks appropriately, the increased sanitizing, and then of course limiting building access in accordance with those health and safety guidelines that we discussed. So scenario 2 then specifically, we've got 2 different models that we're representing here. And one would be at a 50% model where we would run with only half of our students in school at any one time. And a second model, which is a 25% in-school capacity, where only 1/4 of our students would be in school at any one time. So if you look at the first model, the 50% model, there's basically 2 groups of students. So we would divide students in our classes into 2 groups. One group would attend 2 days a week on Monday and Wednesday, and then they would be learning online or asynchronously at home on Tuesday and Thursday. And then that would obviously flip for group number 2. On Friday then, the thing that I really want to call your attention to is in the AM block, we would provide intervention services for students. So this again would be based on a student's IEP needs, their English language development needs, or particular math or literacy needs that have been identified, that morning block of time on Fridays would be reserved to working with small groups of students to provide that additional support. And then we would reserve Friday afternoons for teacher planning time. So that's very similar with the 25% model. Again, the only difference is that you would only have a quarter of your students in school at any one time. So of course, on a 50% model, students would see their teachers for each of their classes 2 days a week. And on a 25% model, they would only see their teachers 1 day a week. The other thing to note on this model is that we would propose at the middle and high school level using an 8-period day. And the reason for that is it would allow more frequent contact between students and teachers. If there's, if we were to maintain an every other day schedule, the amount of contact would be even less frequent than it would be on the model shown here. So we also wanted to show really just a schematic of what social distancing might look like in the classrooms with respect to classroom arrangement. So here you can see two different scenarios. One is on the left-hand side, our secondary, our middle and high school classrooms. And on the right is an elementary classroom. And you can see that the desks are arranged to have 6 feet of separation between the students, which obviously significantly limits the amount of students that could be in any one classroom at any one time. Similarly, we wanted to show you what it might look like for social distancing during transportation and busing. And again, the model on the left-hand side, you can see we would have 1 student per seat. The model on the right-hand side, you can see we would have 1 student every other seat. And even with 1 student per seat, we have really significantly reduced seating capacity. And that would take our bus capacity down to about 23 to 25 students per bus. And we would then cut that in half if we had to be with 1 student every other seat. And that, of course, would require additional buses and additional drivers. And that doesn't seem fiscally prudent to do. So we're really looking at a model of 1 student per seat with enhanced health and safety protocols. And that would mean that when students boarded the bus, they would be assigned a seat. They would be required to wear a face mask while on the bus. And we would provide additional personal protective equipment like face shields to our drivers. And we would have significantly enhanced cleaning procedures in our buses. And all of that, even with 1 student per seat and all of those health and safety protocols in place, still may require us to modify our bell schedules. Because of those additional runs and that additional time for cleaning of our buses, it would be possible that we might need to add another run, another bell schedule, if you will. And that's represented in the chart in the middle so that you can see the difference between our current bell schedules and what those proposed bell schedules would be. And the thing I would call your attention to most is the second elementary bell schedule on the proposed side, which would begin at 10:05 a.m. and end at 4:50 p.m. So again, these are tentative, but we wanted to provide you with what some of the real impacts to social distancing and transportation would look like. And one of those big impacts is on the reduction and adjustments to our bell schedules. So moving to scenario 3, which would be full-time online learning based on individual medical need. Again, at the elementary and high school level, we would try to make sure that we were creating those intact cohorts of students. So students would have dedicated teachers to work with them throughout the year. We would be providing enhanced curriculum, but we would be focusing really on the state requirements. So we wouldn't be able to offer everything that we currently offer in our program of studies, but really focusing on those state requirements. And then we provided some information here on what that might look like in terms of synchronous instruction and what a bell schedule might look like. And you can see we're proposing 4 days of synchronous learning for this model and 1 day of asynchronous learning for this model. Now, this would be very different than what we're doing now. So it would be really important to note that there would be some conditions and some requirements really both for the division and for families. From the division, we would need to make sure that we're able to provide this option to students that have that medical need as defined by the CDC. we would make sure that we're providing those full-time options and supports, allocating the appropriate teaching staff to be able to do so. And it would require some modifications to some of our delivery models for special ed, ESOL, and AAP services. And we would also try to make sure that we could develop a model for grab-and-go lunches. For families, a few really important things to note would be that we would really need to know as soon as possible families that would be interested in pursuing this option. So we've established a date here. It's a tentative date of July 10th. And the reason for that is it's going to take a significant amount of time to develop the additional schedules and assign the additional staff and help the staff be prepared for the first day of school on August 25th to teach in this format. So we really will need to know as early as possible families that might be pursuing this option. Additionally, we would really ask our families to make a full year commitment to this model, as it would be very difficult to change our schedules during the school year. And, you know, we would also really want our families to understand that we really couldn't guarantee that all of our programs and course offerings would be available. We certainly would make sure that students had all the required courses and were on track to meet graduation requirements. But some specialized courses and programs, we would not necessarily be able to offer all of those. So again, thinking about these three scenarios, we just wanted to point out that what you see here on this slide is, as we heard from our colleagues in the health department, COVID-19 really still is a very fluid situation. So at best, we're hoping that the worst is going to be behind us and that we'll be able to continue to ease social distancing restrictions and be able to bring students back to school as soon as possible. But at worst, we do need to make sure that we're prepared if we see a resurgence either in the fall or if we see ongoing waves or outbreaks in certain places in our community. We need to be prepared to be able to return to a distance learning environment very rapidly to ensure that there's not a disruption of educational services to our students. So just a few additional considerations that we wanted to make sure that everybody had as some additional background to think about as we're talking about our reopening scenarios. And the first is support for staff. So again, our goal would really be to ensure that all of the staff in FCPS have the resources and the supports to feel safe and comfortable returning to work. So our HR department is working really hard to update telework regulations and to make sure that staff members in the HR department are available to assist employees in really understanding all of the health and medical leave benefits that are available to them. And they stand prepared to work with any employees that have questions about those benefits. We're also working very hard to secure personal protective equipment and making sure that our folks have the materials and supplies, whether it's masks or gloves or gowns or face shields, depending on their individual assignments that they need to do their jobs safely. And we're making sure that we're providing staff with resources and support to address their own personal health and wellness needs. And then, of course, enhancing professional development in a number of areas, including support for our teachers in the use of virtual or blended learning strategies. And then finally, at the bottom, you see childcare. And we've heard from a number of staff members about the challenges of finding childcare, particularly for school-age children. So we don't have a solution to this, but we do want people to know that we are working on this. We hear you, we recognize this as a challenge, and we are exploring additional opportunities for school-age childcare in FCPS. Additionally, support for families. Our goal here is to ensure that our families have all of the resources and supports that they need to feel safe and comfortable sending their children back to school. So we certainly want to make sure that we're able to maintain the food services that our food service department has been working so hard to provide over the last several months to our community. Our language services are incredibly important in terms of providing, again, oral interpretation services and written translations of all of our documents so that all of our families understand the supports and resources that are available to them. We're also working hard to enhance training, parent training and resources to support parents in understanding all of the resources available to help them, supporting their students' academic success. And then we want to continue and expand the technology support that we can provide to parents and students with computer troubleshooting. We also know that a lot of our families have questions about what summer supports are going to be available to students. And we have discussed this in our May school board work session. And since then, we've developed a number of different virtual summer support programs that we just wanted to reference quickly. For all of our students, kindergarten through grade 12, we have what we're calling continuity of learning services. And here we're providing students with self-directed learning materials. Again, digital materials that I talked about earlier, as well as some written materials. So for example, in kindergarten through grade 8, we're going to be mailing summer practice books in language arts and mathematics. And those materials are really hopefully going to help students with additional preparation for a successful return in the fall. But we know that at times students might need help and have questions. So we've provided staffing to each of our elementary schools to provide teacher office hours on a limited basis, but those office hours will occur on a weekly basis, and all of that programming is free to our students. At the high school level specifically, we've expanded our credit recovery program, and we've increased the capacity of the number of students that we can serve there, as well as allowing students that might not have failed a class but did not do as well as their teacher believed that they needed to do to be adequately prepared for next year. So we're allowing those students to participate in our summer program. Again, that's a virtual model, and it is also free to students. We've also expanded our online campus, so we have more capacity to offer courses for new credit, including ESOL supports, and we've reduced our student tuition there. And we've set recently an all-time record of over 8,000 students who have signed up to participate in our self-directed economics and personal finance class, for example. So we're seeing a lot more interest in our online campus programs this summer. And then for special education, we've designed a virtual model, both for extended school year services, as well as preschool autism. And those programs really begin in late June and run through July. And all of those programs, we're communicating out those different options and opportunities to families currently, and we'll continue to publicize them. We've also had some questions about what's happening with athletics, and we are working on plans to resume athletics, but of course, we have to work very closely with the Virginia High School League to really determine what's permissible, and there are currently very tight restrictions in place. So for example, conditioning and agility is available to begin with strict social distancing on June 22nd. But prior to that happening, all of our coaches are going to have to complete a mandatory training session. And all of those conditioning and agility sessions, it's important to note, are individual sessions. Those are not group sessions, not scrimmage activities, and they would only take place in outdoor facilities. And then also just we know there's interest in the community that our county parks have been begun reopening fields for permitted users for club and travel sports, and that started on last Friday. So we're going to see scheduling of some of those activities, we believe, very soon. So as we begin to wrap up here, just a few other things that we wanted to highlight. One is our communication plan. We know that communication over the coming weeks and months is going to be incredibly important as we really finalize the details of our reopening plans. So our goal certainly is to make sure that we're including stakeholder input in all of our reopening plans. So to that end, as I mentioned, we have a family and staff survey that are currently out, and we're going to attempt to share some of those findings with the board on the June 23rd work session, and hopefully that will inform the board's school reopening discussion. And information in those surveys, we're going to be soliciting family opinions about the different scenarios that we discussed today. We're going to be providing information on staff comfort levels about returning to work and the supports that they need to feel successful, as well as collecting staff and family perceptions in more detail on the effectiveness of distance learning from the spring, so that we can use that information to really refine our reopening plans for the fall. And then finally, we're going to be working to make sure that our stakeholders are up to date with information about our reopening plans. We'll use a lot of our traditional strategies like direct communication, letters, emails, videos, website postings, social media postings, but we've also begun to hold town hall events. There's another town hall event that's going to occur later this week. And we're going to increase our collaboration with other stakeholder groups, community organizations, faith-based organizations, businesses, because we want to make sure that we can get the messages out to people in the communities in which they live and work. And then most importantly, perhaps, is guaranteeing translation services into all of our communication strategies. So Dr. Brabrand mentioned some timelines that are coming up. Again, these are draft timelines. And certainly we don't have all the details worked out yet, but time really is important. And there are key decisions that are going to need to be made soon if we can continue to work towards a smooth operating and opening for next school year. So the first date that you see is June 26th, and that's just a couple days after next week's work session. And the idea here is to be able to communicate our decisions to the public no later than June 26th about our reopening status for next year. And we need also, as I mentioned, to communicate the registration deadline for families that would be opting based on medical need for the full-time online learning option for next year, so that we can begin to establish that program. So the deadline, again, that we've established for that currently is July 10th. Then by August 10th, if we're operating under a social distancing schedule that would require us to have a reduced percentage of students in school at any one time, we really need to be able by August 10th to tell the families which days of the week their children would be attending school. And the reason for that is if families need to find childcare, that only gives them 2 weeks prior to the opening of school on August 25th to finalize childcare arrangements. And then the week of August 17th through the 21st, we would want to ensure that families have information at the middle and high school level about their schedules, and then also making sure that we've established technology distribution plans and communicated all of that information to the community. So finally, here we've prepared essentially the 3 different scenarios that we've discussed with some benefits and risks. And we think that this just might be helpful in thinking about how to compare some of these different models. But again, we believe that we need to be prepared to offer these different models. Scenario 1, of course, again, virtual learning for all. There actually is, on the benefits side, some consistency for students and teachers. And there's 4 days a week of contact time that students would have with their teachers under this model. Of course, the risk side is that in a virtual environment, some of our students may become more disengaged, and we may see widening of achievement gaps, for example. In scenario 2, where we would be bringing students back with social distancing guidelines in place under a reduced percentage of students, the benefit, of course, is that students would have more opportunity for that face-to-face, in-person connection with teachers and peers, but significant amounts of asynchronous time would exist in this model. So for example, even on a 50% model with social distancing, students would still be learning asynchronously or at home 3 days, well, not at home, but they would still be learning asynchronously 3 days, up to 3 days a week. Childcare also is a challenge and a risk with this model. And it's also going to be difficult to maintain social distancing in our schools. And then scenario 3, full-time online enrollment for those individuals with medical need. It certainly is a benefit that it would meet the needs of students that would have a severe risk of illness. But again, there would be, on the risk side, some limitations to program offerings and limited social interactions. So as we close out the presentation, we want to provide some information on the budget. And I'd like to invite Ms. Burton to discuss some of the financial needs that are associated with the reopening scenarios that we've discussed so far.
Good afternoon. If you look at this chart, it basically shows 4 columns. The first column is the item or description of what we're planning on funding at this point. The second column is the 9.3 recurring post-COVID-19 placeholder that is in the fiscal 21 budget. The next column, or third one, is the one-time CARES grant of $19.2 million. The total original request is the 4th column, and then the unmet need is the final column. So the first item is personal protective equipment cloth masks and other PPE like face shields, gowns, and gloves. Those are being funded at $5.2 million under the CARES grant. And just so you can understand how this little spreadsheet works, the total original request for PPE was $5.9 million. We had assumed a greater number of cloth masks, but due to funding levels, we pulled that down by about $700,000 so that the final amount ends up being the $5.2 million. And you'll see the same thing in many of the items, in that the original request is a higher amount, but we've scaled back what staff and leadership believed was needed to fall in line with the recurring placeholder of 9.3 and the CARES grant of 19.2 million. Facilities cleaning, the second line item is at 2.3 million, and that is for 3 months custodial staff overtime and additional cleaning products for buildings and buses, again at 2.3 million. Thermometers, we're assuming handheld thermometers at 1 per 500 students as far as allocation to the schools, plus central offices, that's about 200,000. Health service staffing, that's 5 nurses at a cost of 600,000. Technology connectivity, we think we'll need another couple of thousand of MiFis. The actual devices cost $100 each, but the connectivity piece is an ongoing cost of $300 annually. So you can see that those items are split up between recurring and one-time funds for a total of 0.8. A full-time SBITs at every elementary school, that will add 13.5 SBITs to the elementaries at 1.6 million. A full-time T-SPEC at greater than 750 enrollment. At 1.9 million, we have only funded 16.5 out of this recurring COVID fund that we have in the fiscal 21 budget. But recall that there's also a $2 million placeholder, and so we've opted to fund 8 of the T-SPECs out of the that technology infrastructure and support placeholder at about $1 million. And again, that decision was made because we do not have enough funds within the recurring placeholder and the CARES grant to be able to fund everything that we need to do. Curriculum resources, digital resources for K-8 for language arts and math is 2.6 million, and that is for student self-paced digital resources to support intervention. Curriculum resources for social emotional, that at 1.1 million, that is a screener to assess social emotional learning competencies and curriculum development for social emotional learning. Intervention support staffing is hourly funds to provide to schools on a per pupil basis at $13 per general ed student and $26 per free and reduced lunch student and EL student. And that's just a formula to allocate funds that schools could use for hourly teacher staffing. The next item is additional counselors. 10 counselors at $1 million and 10 psychologists at 1.1 for a total of 2.1. The special education remediation and recovery with the focus on the fall of 2020 is 2.9 million, and that is for tutoring, related service therapies like OT, PT, speech, those sorts of things. That's at 2.9 million. Student registration and scheduling, of course, with these scenarios, especially the hybrid or staggered one, there'll be master schedule revisions, class adjustments, class balancing, tracking attendance, those sorts of things that will need to be addressed, and that is costed at 2.3 million. And then the last thing on the list is elementary school laptops. You know, we would like to do an outright purchase for those 22,000 laptops, but we just don't have enough flexibility within the CARES grant and the recurring post-COVID funds to be able to do that. So you don't see those identified here in the first 2 columns with numbers. Instead, we'd like to fund those with lease funds, which would make the first payment in fiscal 22 at 2.8 million each year for 4 years. And there's a note at the bottom of this chart that indicates that. So the total for all of these items under recurring is 9.3 million, which is what is budgeted. For the one-time CARES grant, it's 19.2, again, aligning with the funding level. The total original requests that various staff members and leadership and the workforce has put together total 54.9 million, leaving 26.4 million that is needs that are unmet, again, due to funding levels.
All right, thank you very much, Ms. Burden. So we are just wrapping up now, and we just wanted to remind everybody of the guiding principles as we close this presentation that we've been working under. And I want to thank you for your attention. I know we went 30 minutes over, and I apologize for that, but there certainly was a lot of information to cover. So with that, I'm going to turn it back over to Ms. Sizemore-Heiser and Ms. Pekarsky to facilitate the board discussion.